Starting this Monday, September 24th, we're going to start the process of getting rid of the FPact and Adult Codescan sheets that the clinic currently uses to perform billing. To be clear, the Codescan sheets won't disappear immediately. That will probably take 2 to 3, maybe 4 weeks. And we will still be using Codescan for prenatal visits for a few more months. But on Monday, we providers will start using NextGen to bill. For the billing department, once the department obtains a 90% or above concordance between our Codescan and NextGen billing, then we can stop using that Codescan sheet. Hopefully, this won't take us too long to obtain. The purpose of this training video is to show you how to bill and document correctly in NextGen. There are actually very few new things that you need to learn. We will spend most of our time reviewing things that you should already be doing that are necessary for correct documentation and billing. Let's first take a look at the new things. Here is a sample FPact visit. The patient is coming in for a refill of her birth control pills and would also like sexually transmitted infection testing. I've already filled out the subjective and objective and completed my assessment plan and orders. There are two things you should notice. One is that a billing tab has been added at the top of the SOAP template. And two is that there is now a prominent complete billing bar right near where you generate your note. These will now always appear except when your MA sets in the intake template that this is a prenatal visit. So, you will generate your follow-up slip and note, just like always. So, you will generate your follow-up slip and note, like always, and then review, edit, and sign your note. Then you need to go back to the SOAP note and complete your billing by clicking on the Complete Billing bar. So this is the billing template. Though it looks complex, it is actually very simple to use. In general, you only need to make 2 clicks in this template and you're done. First, you need to select the E&M code in this section. You can see you have your newly established visit codes, as well as well-child and well-adult codes based on age. There are also FPact education and counseling codes as well here that appear only if the patient is using FPact insurance for this visit. Click on the code relevant for your visit, and you will see your code is entered into the visit code section in the code submission area over here. If you need to add additional codes or modifiers, click here and you can do so. You can even add additional FPact education and counseling codes by clicking here. When you've selected your appropriate code or codes, all you need to do is click the Submit Codes button. And your charges are sent. That is all. You don't have to worry about the other things on this template, including the provider sign-off section, which is used by attendings and residents, or the history summary section, which can be used to calculate billing codes, though I encourage you to poke around. You're now done with your note, and click on the Inbox button to go see your next patient. In order to get rid of Codescan, you have to make sure that you use the My Plan section of NextGen fully, so that patient visits are billed appropriately. Let's take a look. In this example visit, the patient is coming in for a pap smear and a Mirena IUD insertion. I've already filled out the subjective and objective sections and entered in my assessments. Now let's complete the My Plan section. Let's first do our orders for the gyne exam. You'll notice that on FPact visits, you'll see a link to valid FPact lab tests. Click on it to get the list. As you well know, FamilyPact only pays for a few tests for its patients' visits. Things like rheumatoid arthritis panels, hemoglobin A1Cs, and RAS testing aren't paid for, so think twice before ordering those on FamilyPact visits. Your patients may be upset with the results if you don't. Fortunately, pap smears are covered, and so there's no problem ordering one. You'll notice items in the Provider Procedures and Tests sections are now in red. We did that to call your attention to them, as these are procedures and tests that 1. We bill for, or 2. We track for clinical or grant purposes. There are about 50 items. Please familiarize yourself with them. Most of the common and essential ones have already been added to the relevant order sets for your convenience. In this example, a wet mount with prep and a clinical breast exam. In this example, we performed a breast exam at this visit, so I'll make sure to check off that we've done one. Now let's place the order so they get recorded. Let's now switch to the IUD insertion. As noted before, we check off the insertion procedure in the Provider's Procedures and Tests section, but we need to do a little more too. The office medication section is not for meds we prescribe at the visit, but rather medications that we actually delivered in the clinic. In this case, we gave Mirena, and so we'll select that. You can click on the down arrow to get a full list of available medications. Please note there are actually 2 medicine lists, one for FamilyPact visits, those often have X and Z codes, and one for non-FamilyPact visits, which often are J codes. We are still adding more codes, so let us know if something's missing. If something is missing, for instance ibuprofen, you can always go to the MA Lab Orders and Tests section, select Free Text, and then type what you need. Place your orders so they get recorded. Please note that in the rare case where you attempt a procedure but cannot actually complete it, you still bill for that procedure in the Provider Procedures and Tests section. The only difference is that for a failed IUD insertion, you do not bill for the IUD itself in the office medication section, even if it becomes unsterile. Of course, you must make sure that your progress note accurately reflects what occurred so that our billers understand the lack of a billed Mirena for your visit. I want to focus on that a little bit more because I've received some concerning reports about this. You must make sure your progress note accurately reflects what occurred. If the patient is already gone, don't place orders for something like a PPD, and make sure to edit it out of your generated note. Leaving it in can be fraudulent. Since the Provider Procedures and Tests section is so important, I just want to hit on one more thing. For diabetic patients, there are a number of Provider Procedures and Tests that you want to be vigilant about checking off. And those are the PHQ-9, the self-management goals, and the foot exam. Please be aware of them. Lastly, I just want you to be a little bit more aware of what our MAs do during checkout. They process our lab orders and push them to Quest. And if we do not order a valid lab, they can, with our permission, cancel an order. They bill our procedures. This is the equivalent of bubbling in an item on the Codescan sheet. And they also bill for the medications we dispense. They also record, for tracking purposes, whether pap smear was ordered, mammogram was ordered, or the patient was sent to X-ray at California Hospital. Also, so you're aware, if at the time of discharge an E&M code has not yet been submitted, then a task will automatically be sent to you, the provider, letting you know that your billing has not yet been completed. Keep in mind it's automatically sent. The MA has absolutely no control over it. So if for some reason you realize that you forgot to bill for a procedure after the patient has already gone through discharge, please go and tell your MA to open up the checkout template again and then push that new procedure through that you've since added. As you can see with NextGen, the discharge position is actually very important, and if we skirt around the discharge MA, the procedures won't be billed, medications won't be billed for, and our lab orders won't be sent off to Quest. So working with the discharge MA and incorporating them into your workflow is a necessity. And without them, we won't be able to get off Codescan.